This is Chapter 19 Addiction, just focusing on the medication treatments and a little bit about the psychopharmacology for addiction. So, drugs used to treat are alcohol. When we're talking about withdrawal symptoms, we can use short-acting benzos like lorazepam, Librium. We can also use this chlordiazepoxide. This is a long-acting benzodiazepine that can be used for treatment. If we're talking about maintaining abstinence, there's antabuse. Antabuse provides aversion therapy, and we'll talk about that more on the next slide. We also have medications that can suppress the cravings. Now, they're not going to eliminate the cravings, but they can suppress it. Additional treatments that we need to note for our alcoholism, for those that are having some nutritional deficiencies, we're going to be looking at folic acid and vitamin B12. And then if they develop that Wernicke's-Korsakoff syndrome, the treatment's going to be thiamine, which is vitamin B. More about the antabuse. So this is aversion therapy for alcoholism. When the client takes in alcohol after taking this medication, they're going to have just nausea, vomiting, feeling horrible. Side effects, it can make them feel a little fatigue, a little drowsiness, making them some bad breath. Impotence would be a reason why they would stop doing it. We do need to be mindful, though. It can have interactions with other medications, and they can also have the same type of aversion therapy if they consume or use other products that typically contain alcohol. So things like cough medication, mouthwash, aftershave, hand sanitizer, all of those can have alcohol in them. And if they take the medication and handle those products, they can get that same aversion therapy. Our medications for opioid treatment, we can start them on a program like a methadone program. And as we've said, methadone is going to help with the pain, but it's not going to give them that euphoric effect. We can do something like Suboxone, which is a combination drug that's going to help with the cravings. With our Suboxone programs, they have to enroll in the program. They're going, sometimes weekly for drug tests and therapy. And then slowly they'll do that every 2 weeks, every month, every 2 months. Um, Other medications, we can have things that block the effects of it, and then we have something like that completely suppresses the opioid withdrawal, like our clonidine, which is also known as Catapres, which is an alpha-2 adrenergic ag agonist. We normally think about it as a big gun for hypertension. However, with clients with opioid dependence, it suppresses some of the effects of withdrawal. Most effectively, it helps with the nausea, the vomiting, and the diarrhea, and it also can produce some moderate relief from muscle aches, anxiety, and restlessness that these clients experience. For cocaine, there is actually no drug that's really assigned for it. However, we do have these four medications that are used off-label to decrease the cravings that people experience for cocaine, and those are listed here. And that is actually it for our pharmacological section.